My name's Caitlin. Hi. So can I lift your tuck up and have a feel?
Just 1 second.
Okay, before you even do that,
Can I?
you need a bit of history. Okay.
Okay, ask her questions about
Yeah, what would be helpful?
how many weeks pregnant are you?
28.
28 weeks. And
What else would be helpful?
Can we also ask?
Yeah, what in terms of history would be helpful before you even put your hand?
have you had any problems occurring through this pregnancy at all?
And scans, okay. Wanneer was die laaste een?
22 weeks.
22 weeks, okay. En wat het hulle daar gesê?
This is normal.
Okay.
But you just can't see what baby is.
The sense of the baby, okay.
And placentas, do you know where the placenta was?
The head is this side and the head is this side. Okay, what else would you like?
The head as well?
It's not going to be of any use 6 weeks later. So it doesn't matter.
Yeah.
That's what it was at 22 weeks. Okay.
Is this your first baby?
Sorry?
Is this your first baby?
Second one. Okay, good. You need to know what the parity is. And
What was your first labour and birth? Did you have a vaginal birth or cesarean?
yeah, vaginal birth. Okay, also useful information to know.
Was daar enige probleme na die tyd soos met any problems afterwards with bleeding?
No.
Did you breastfeed after
Yeah.
baby? En for how long?
6 months.
Hoe lang was die labor?
4 hours.
4 hours. How long was the
Wow.
labor?
Mm-hmm.
That's good, eh?
She said it was an easy.
Easy first birth. Okay.
Yeah.
So for me, the most important thing is to find out about coming to approach this particular mother at this antenatal visit for this palpation is parity, how the first baby was born. So you're looking, if there was a Caesar, you're looking for scars and where they would be, okay? And if you see anything that looks suspicious, to try and investigate further, like for example, your transverse versus your up and down scar. Yeah, your longitudinal incision as opposed to your transverse incision. How old are you?
26.
26, because your age of the mother can also impact on just general body tone and how very often your sort of teenage pregnancies, those abdominal muscles are very, very tight, as opposed to an older woman like 36 who won't. So it'll impact on how easily you feel what's inside. Okay.
The younger or tighter?
More difficult.
More
More
difficult,
muscle
more
tone.
muscle tone. The younger the rectus muscles are. Okay. And then of course, what you have already asked, gestational age, just as a clue as to what you might be expecting, and if there was a scan to correlate unsure dates around if the dates are unsure. Okay, great. Right, move on.
Okay, can we lift it up now?
You just want to get to the baby.
So I think the first thing that you would do is just visualize the tummy and say, like you said, to see any scars, scarring or anything like that. Is
Okay,
it
so
okay?
inspection is your first observation.
Visual inspection.
And so because she's 28 weeks, we can you expect to find the height of the
Well, actually, without even touching, you're going to just look and see. Without even going anywhere near, putting your hands anywhere near, what do you see? We're going to be very rude and take your trousers down a little bit more. Thank you. Oh, nice. Soft. Okay, so just look.
Okay, she's got a linea nigra that's going almost all the way over.
Does everybody know what a linea nigra is?
Oh,
Do you,
and
Tia?
The line.
N-I-G-R-E-A.
And you know what that is? Can you see the linea nigra? Okay.
I can see
Okay.
it, but that's not in everybody, hey? Or what?
Actually, in about 80% of pregnant women, you will see it.
And it's saying what? Anything?
It's basically
She's
what it
pregnant.
is. Yeah.
Because I never had one.
It's a landmark of pregnancy. It goes together with cloasma
Oh,
that some
okay.
women get. It's a line of pigmentation
It's skin.
that is enhanced during pregnancy.
Okay.
Okay. And according, can I be silly with you? Hey? According to what this line, what have you got at home? A boy or a girl? A girl. According to what this line says, but you don't take any notice of me, see? It is, if it goes straight through the belly button, it's a
Ball.
Mine went straight through the second time.
I know, that's a load of nonsense.
Nonsense.
The old wives used to say, if the line goes straight through, it's a boy, and if it goes crooked, it's a girl.
Mine all went straight through.
But it's not really
It
true.
all went straight.
It went straight through.
Yeah,
We just like to be silly, so don't take any notice. It's just
If
a
it
simple
goes
line
straight
through.
through, then
It's a boy. Yeah.
Well, let's have read the reflexology point here. Also, that if the puffiness is on the left in this area, it's a girl, and if the puffiness is on the right, it's a boy.
Okay.
So you get that all over, huh? Sometimes it's also like
I have a bit of nonsense.
Okay, what
left
else?
is girl.
So
Yeah.
you see, yeah.
Any scarring? There's no scarring.
And apart from a cesarean section scar, what else might you see?
There might be an appendix scar or some kind of surgery done abdominal.
Kidneys and stuff.
A lot of time you now see that little laparoscopic, the incision where they would go in if there'd been any infertility problems, they would have done a laparoscope. Okay.
And so many bellies have been pierced.
Yeah.